So today we are going to be discussing Medicare 101. So really just getting the basics here, getting your feet wet, and hopefully answering a handful of the questions that you're coming in with. So I am Ben Rothering, the Medicare specialist here at WDS Health. I joined Wealth Distribution Strategies about 2 or 3 years ago here, and it's been a great partnership. It's a great opportunity for people to get a lot of their major services all under one roof. Having their finances taken care of, um, myself taking care of their health needs, their Medicare needs, and having an in-house tax guy. And it's really adding a full team to your retirement needs. So it's a great opportunity there. So we'll get going here, and I'll tell you a little bit about myself as we go. So that's my crew. A little bit of a dated picture by a couple years because now my youngest is taller than my wife, and he likes to make sure that she knows that. Um, but what I do on a daily basis is really helping people with Medicare and helping with Medicare supplements, Medicare Advantage plans, drug coverage as well. And when people are getting done with their group coverage, they like to be able to continue their dental, vision. I also help with extended cancer protection, funeral and estate trusts, and then a whole bunch of different opportunities for life insurance, whatever your needs are. So anything we can do to help you out, we're here to do that and make sure that you feel like you have a good retirement protection plan in place. So the things that we're going to be discussing this evening, we'll talk a little bit about Social Security, but more how it relates to Medicare itself. And we'll talk about your eligibility into Medicare, how do you enroll, Medicare enrollment periods, if you retire before you are Medicare eligible, or if you work beyond 65. What happens if there's a spouse in the mix? What do we do there? And then the 4 different parts of Medicare as well as your coverage options. Now, I am going to pause real quick and just say that everything that we discussed today is based on what's going on today, the rules of today. We don't know how things can change, but as far as right now, that's kind of what we're going to work with here. So starting very basic, Medicare, what is it? It's a federally funded program. We all pay into it. It's typically going to be for people who are 65 or older. It can be for people who are under the age of 65 if they qualify due to a disability or if they have permanent kidney failure or something like that. Not to be confused with Medicaid. Medicaid is federal and state funded and going to be more for people with limited resources. So Medicare started in 1965. It's run by CMS, which is Center for Medicare and Medicaid Services. And again, mainly for seniors. And over the years, they tried to, I apologize. Over the years, they tried to enhance Medicare a little bit by adding drug coverage. And the Inflation Reduction Act a few years ago really did a great job at rolling phases in each year and helping bring down the cost of a lot of medications. The donut hole is something that went away this past year. Everybody cheered when that happened. So a lot of good things have happened to really make Medicare better, especially on the drug plan side. And then preventive care as well with the Affordable Care Act. And there are a lot of resources out there. I believe the Medicare and You booklet gets automatically sent to people. There's a lot of information out there. So now, as we begin, the nice thing about doing a webinar is everybody that's on here has some level of comfort using technology. So what I would recommend is if you don't already have an online account created at Social Security, so ssa.gov, I would certainly create that account, and the sooner the better. It's a great and easy way where we can go in and enroll you into Medicare, and that's where a lot of things are getting steered now with, Social Security offices either closing or just being understaffed. It takes a long time to get in there and get those things done, and we can roll through an online application pretty quick and easy in the comfort of the office or your own home. So part A. Now, as we get going here, I'm going to refer to 2 different groups. So one group is a group that is not yet receiving their Social Security benefits. The other group already is. So the reason why I break it down that way is because if you are someone that is getting ready to turn 65, And if you've already started receiving your Social Security benefits, Medicare, they guess what? The government knows you're getting ready to turn 65. And so they are automatically going to enroll you in Medicare A and B. They're going to send you your card 3 months ahead of your birth month. And you have to decide what you're going to do with that card. And we'll go further into that momentarily. If you are not receiving Social Security and you plan on going on to Medicare, we have to do that enrollment. That's where that online account is going to be very, very helpful. Now, Part A, it should be premium free for most people. As long as you or a spouse have paid taxes, you've worked long enough, then Part A should be premium free for most people. So everybody is going to fall into one of these three enrollment periods. And I'm going to start with the first one, the initial enrollment period, and then I'm going to skip to the special enrollment period before I go back to the general. So the initial enrollment period is a 7-month window when you are approaching 65. So it starts 3 months ahead of your birth month. It includes your birth month and goes 3 months after. Now, if you're planning on going on Medicare when you're turning 65, I highly recommend we take advantage of the 3 months ahead of time. It's a gift, makes things a lot easier. Doesn't mean we can't make it happen later on, but if we want to simplify it as much as possible, we should use those 3 months ahead. And typically, Medicare is going to begin on the first day of your birth month. And that's assuming that your birthday is either on the 2nd all the way to the 31st of the month. So then it will begin on the first day of your birth month. Now, the only difference would be if you are born on the first day of a month, you get to start a month ahead of time. Now, the special enrollment period, this is for people who decided that they weren't going to jump into all of Medicare. Maybe you still have group insurance through your own employer or a spouse's employment, and they're going to keep working a little longer and go beyond 65. And when retirement comes and that group insurance is going to end, now you fall into a special enrollment period. This is a qualifying event when that group insurance ends, and it allows you to pick up any other parts of Medicare and all your other options without getting penalized for doing so at a later date. Okay. The initial and special enrollment periods, these are really, really important time frames because during those two time frames, nobody can ask you any health questions and use it against you. Your health history, anything you've got going on currently, none of that matters. You have to be accepted. They can't deny you. Now, the general enrollment period, that's going to be where the penalty comes in. So that's going to be where maybe somebody turned 65 and they were uninsured. They didn't have group insurance through an employer. They didn't go on to Medicare. And let's say a couple of years go by and now they're 67, 68, and they're thinking, hey, I should probably pick up Medicare and get some coverage. Well, now those people have to wait until January. And January, February, March, starting each year is the general enrollment period. And that's when you're allowed to enroll in Medicare. But at the same time, those are the people that are going to get that penalty, and it's a 10% penalty per year on top of your premium for Part B, and that goes for your entire life as long as you have Medicare. Okay, so we don't want to fall into the general enrollment period. We'd prefer to keep you in the initial or the special enrollment periods. Now, Part B, again, when we go back to those two groups, if you if you're already receiving Social Security and you're turning 65 and they send you your card 3 months ahead of your birth month, if you are planning on continuing to work or you have a spouse and you still have that group coverage, well, that's where you flip that card over and you can check the box that says, hey, I don't want B right now because I still have this large group employer coverage. And Part B is going to carry a premium with it. And more often than not, uh, you know, why pay a premium for Part B when you're already paying a portion of your premium through that employer? Okay. Now, the differences here, this is going to be kind of what we call the rule of 20 between a small group or a large group employer. So they consider a small group employer, meaning you have less than 20 employees, and a large group would be over. Okay. So, and please always check in with your human resources department, but the typical rules are if you're ready to go on to Medicare and your employer is a small group, typically you're going to take Medicare, and that's going to be primary, and then the group insurance will be secondary. But if you have a large group employer, that's going to stay primary. And so there's no reason to take Part B at that time because you don't want to pay a premium for it when it's going to sit secondary to the group insurance. Okay. Um, Something else that can kind of throw a little bit of a wrench into the mix is if you are contributing to an HSA, a health savings account. So you are not allowed to contribute to a health savings account and have any part of Medicare. Okay, you're not allowed to overlap those things. So if that's something that a category that you fall into, then that's certainly something that we can take a look at and chat about and make sure that you don't end up having to pay some of that contribution back. Okay. Now, as I mentioned, Part B is going to carry a premium along with it. And right now, the way that they determine that premium is they look at how you filed your taxes from 2 years earlier. So this year they're looking at 2023. And if you filed individually or if you filed jointly, okay? And and they're going to put you in one of these brackets. And then you can see on the bottom row what your Part B premium would be. So the base premium is $185. Okay. How do these Part B premiums get paid? Okay, let's go back to our two groups. If you are not receiving Social Security, but you decide you're going to go on Medicare, that's fine. You can do those things at separate times. But if you're not drawing Social Security, then the government is going to start by billing you quarterly. So you'll get a bill in the mail, and it should designate the months that that bill is for. Okay. If you are receiving Social Security, then what's going to happen is they are going to deduct your premium amount prior to depositing your Social Security money into your account. Okay. Now, if you find yourself in one of these higher brackets, then yes, your Part B premium is going to go up. There's also going to be an additional towards a drug plan premium. And as years go on, if your income goes down, then yes, your premiums can change. They can go down. So the government, they're talking to the IRS, right? They're going to send you that letter and they're going to tell you, here's what we expect your premium to be. And if you disagree, you have the opportunity to appeal, and they give you a list of reasons why you might think that that they're wrong, and you can certainly appeal and see if you can get your premium knocked down a little bit. Something to keep in mind though is all of the numbers that you're going to see today. So all the premiums here, even the brackets that you see, all these numbers they change every single year. And even the copays and deductibles that we're about to talk about as we get into the different parts of Medicare, those all change from year to year as well. Okay. So we are going to get into the what we call the alphabet soup of Medicare here. So the A, B, C, and D. So A is your inpatient hospitalization. B is your outpatient medical. Part C is Medicare Advantage. This is privatized Medicare. And then Part D is prescription drug coverage. So we're going to break each of these down individually. And as we do that, we're slowly going to fill in this healthcare pie a little bit. So we'll see where Part A is going to come in and help, where Part B is going to come in and help. But then we're going to see where there are still going to be potential gaps and what we might need to think about as far as picking up and filling some of those gaps in. So Part A is all about your inpatient hospitalization. If you are admitted to the hospital, and I stress the word admitted because there's a difference between admittance and observation into the hospital. Okay. It doesn't mean you're not covered, it's who's covering it. And is Medicare going to continue to follow you? Because there are certainly rules and regulations that we need to follow. And I'm going to explain that shortly here. So if you were to be admitted to the hospital, what that does is it initiates this first 60-day benefit period. And in those first 60 days, Medicare is going to cover everything after the Part A deductible has been paid. The Part A deductible this year is that $1,676 that you see on the page. Now, if you stay in the hospital longer than 60 days, then you have these daily hospital copays that Medicare leaves behind. When we get down to those lifetime reserve days, those are one-time use days. So if you happen to be in the hospital for 95 days straight, then you've dipped into 5 out of those 60 lifetime reserve days, and you're down to 55 for the rest of your life. Okay. Now, what I really want you to get out of this slide here is that these first 60 days, that initial benefit period of 60 days, that can recur potentially every 60 days. So what that means is if you were to be admitted to the hospital and then say after a week you're discharged, and then 3 months down the road, if you're admitted to the hospital again, then that 60-day benefit period, it starts all over again. Okay. So it you wouldn't necessarily, hopefully, run through all of these days, even the lifetime reserve days, because those 60 days, those can start over. Okay. Now, if you know that upon being discharged from the hospital that you have to go into skilled nursing facility. So here, this is where we have to know, were you admitted or under observation? Because in order for Medicare to follow you to rehab and skilled nursing, then you have to have been admitted officially for, it says 3 days here, it's 3 midnights. So admitted for 3 midnights, then Medicare will follow you to a skilled nursing facility, assuming you head there within 30 days of leaving the hospital and you're at a Medicare approved facility. So this benefit works on a 20-day benefit period. So Medicare is going to cover those first 20 days. And then for the following 80 days, they leave a little bit behind. Okay. And then to finish up the Part A benefits, when we talk about blood work, this is like inpatient blood work. So transfusions, and Medicare doesn't pay the first 3 pints of blood each year, but they'll cover everything after that. Home health, Medicare is going to pick everything up that is considered medically necessary. That's a really important term. Everything that you do, any test, procedure, or move from place to place, whatever it is, we want to make sure that your providers are proving to Medicare that it is a medically necessary thing to do in order to have Medicare make sure they're on. We can't just go do whatever we want whenever we want. It has to be considered medically necessary to make sure that your full coverage is there. And then the hospice benefit, it's a pretty amazing benefit. This is a kind of a gold standard. My wife is a nurse by trade and has her master's in end of life care and dementia. She was a hospice nurse for a number of years doing in-home care, got more into the teaching route. But this is such an amazing benefit that takes really covers everybody almost completely. There's the only potential for any out-of-pocket costs when it comes down to hospice. You might have a copay for a medication if it doesn't relate to that terminal diagnosis, or if you are staying at a facility, living there as a full-time resident, then the cost to live there, that may end up being an out-of-pocket expense, like the room and board, but the medical care that relates to a terminal diagnosis is really well taken care of. So this is how Part A is going to jump in and start filling in that healthcare pie. Okay. I'm going to wet my whistle real quick. So I'm doing a lot of talking. So let's jump into Part B here. So Part B is your outpatient, regular doctoring, specialist visits, therapies, durable medical equipment, ambulance services, preventive care, those types of things. And when you start Part B, you have 12 months to do this Welcome to Medicare preventive visit. And then every year after that, Medicare is going to pick up an annual wellness visit. So these are check-ins with your doctor. Neither one is a full-on physical examination of old. It is going in and filling in a questionnaire and having a chat with your doctor. Memorize 3 to 5 words for a memory test. They'll probably check your eyes, your ears, your nose, renew your medications, and see in a year type of thing. So just to check in, making sure that your doctor knows what's going on, and if there are any changes, then you can bring those up. Okay. And part of Part B is covering a handful of different preventive services. So here's a handful of them. It's not all of them. Medicare has their list of preventive services and the frequency that they want to cover them. So, here an abdominal aortic aneurysm screening, they'll cover one in your lifetime. Mammograms once a year, blood tests every 5 years, colonoscopies every 10 years. Now, some of you might look at that and say, well, hold on a minute. I had a colonoscopy and the doctor found polyps, and now they said they got to see me every 5 years or every 3 years, right? Again, we go back to that medical necessity. As long as your provider is proving that it's medically necessary to see you sooner than that 10-year time frame because you are an at-risk individual, Medicare will jump in a little bit sooner on that then. When we talk about flu shots, let's just talk vaccines in general. Medicare Part B, they pick up a flu shot. They'll pick up the pneumococcal shot. Part of the Inflation Reduction Act forced a lot of these drug plans to cover other things like the shingle shot and RSV and those types of things. And what I would recommend, and this isn't anywhere in the, on these pages here, but any vaccine that you're looking to get, if you can get it at a pharmacy, do that. Don't do it at the doctor's office. Trust me, it'll make your life a whole lot easier because the pharmacy is going to bill Medicare Part B, and then they're going to bill your drug plan, and everything should be good then. If you go to the doctor's office and get a vaccine, they're only going to bill Part B, and then you have to submit a claim to your drug plan and get it covered and wait for all that to happen. So if you want to simplify it and kind of take yourself out as the middleman, then get those vaccines at a pharmacy. It'll make your life easier. So Part B works a little different from Part A, right? Part A had that 60-day benefit period upon admittance. Part B has an annual deductible. So the annual deductible for this year is $257. So that needs to be paid before Medicare is going to jump in and pay their 80% of what they consider as, Medicare eligible charges. Medicare Part B, they're going to pick up 100% of clinical lab services. We talked a little bit about those preventive services, but they aren't going to cover anything that exceeds the Medicare approved amount. So what that means is that if you have a provider that doesn't accept what they call accepting assignment, which is accepting Medicare's discounted rate, then they can actually charge 15% more than the Medicare approved amount. And the difference there between the Medicare approved amount and that extra 15%, that's called an excess charge. Okay. And Medicare doesn't pick that up. That's something that, as we talk further and talk about the other plans, we can discuss that and show you how that can get picked up. Now, what is Medicare not going to cover? A and B are not going to pay anything as far as routine dental, vision, or hearing. So they aren't going to help with your teeth cleanings or getting a crown or a root canal. They're not going to help check your prescription. They're not going to help with glasses, contacts, hearing aids, anything like that. Long-term care, alternative medicine. If you are someone who likes to do more of a holistic approach, that's fine. Medicare just isn't going to be a part of it. You're going to be paying out of pocket for that. Electives like cosmetic surgeries, they don't pick up personal care. Medicare does not leave the country. They will go all over the United States, but they will not cross the border. We'll talk a little bit about prescription drugs and then non-medical expenses. So non-medical would be something like, if you received a diagnosis that you don't like and you want to get a second opinion, and let's say you find a specialist that's halfway across the country. Well, Medicare is not going to help you get there. They're not going to pay your travel costs, your lodging costs. If you're going through treatment and you lose your hair, they're not going to cover a wig or anything like that. So this is how Part B is going to jump in and help fill in that healthcare pie. But you can see there's still a lot of gaps there, and we kind of talked about a handful of those. And we're going to show you a little bit of how we can try and help with those gaps. So A and B, we move on to Part C. So Part C is all about Medicare Advantage, or what we call privatized Medicare. Okay, so first you enroll in A and B, and then if you decide to go the route of an Advantage plan, then what happens is now you've enlisted this private insurance company to really come in and take over for Original Medicare. So they're going to take your A and B and they're going to kind of put it up on a shelf. You still are paying that Part B premium, but now that's just getting rerouted to this this private insurance company that's now administering your plan. Okay, and now these Advantage plans, they do have rules to follow. They have to be a part of what Original Medicare would normally consider as medically necessary. But this is where you are going to have networks, which are things that we're used to with our group insurance, right? So you're going to have HMOs, PPOs, you've got certain doctors, providers, facilities that you have to go to. And if you want to get a second opinion, then you need a referral to go get a second opinion, outside of that network. And networks can change from year to year because every year Medicare has to, the Advantage plans, they have to renew their agreement with Medicare. And they work in these service areas. So what they're going to do is they grab, a handful of counties. And the next year when they reevaluate their plans, well, they might pull another county into that service area, or maybe they cut one out. And if if you live in a county where you just got cut out of that service area, then the plan could potentially cancel on you, which is what we mean by optionally renewable, that the plans could potentially cancel on you. They don't typically go away completely. It's more of a service area change that could affect it. Okay. When we talk about out-of-pocket costs that can change over time. Now, I'm going to be very, very simplistic here, okay? Because there are a lot of different options that are out there, but we've probably seen all these commercials with the Advantage plans where you can find a plan that has little to no premium, right? So an Advantage plan can certainly be something where you pay little to nothing on the front end, and then they give you a max out of pocket. So let me just throw out some arbitrary numbers. Let's say you pick a plan with no monthly premium and a max out of pocket of $5,500. Then what that plan is going to do is they're just going to give you your structure, your outline of coverage, and say, whatever medical service you use, here's the copay for that particular service, and it counts towards your $5,500 max. Okay. So maybe it's a $15 copay to go to your primary, or a $60 copay to see a specialist, or you got to pay a couple $100 if you're hospitalized, and you're paying, two, three, $400 per day for the first handful of days. Um, so, if you have an outpatient surgery, something like that, they're just going to tell you, here's your copay for that particular service, and it counts towards your max. And if you hit your max, then you're covered for the rest of the year. Okay. Um, One of the other benefits of Advantage plans, other than being able to start with no monthly premium, is that they're going to include a lot of these other things like drug or prescription drug coverage, or they might give you some dental, vision, hearing, other benefits that original Medicare isn't going to be a part of. Now, we do have to be careful, because you could compare a couple different Advantage plans side by side, and they both claim that they offer you, let's say, dental coverage, but we got to dig a little bit deeper and see that maybe one of them, only gives you $1,000 of coverage, and the other one gives you $3,500 of coverage. So we really want to dig in, because they're not all the same. They can structure their plans however they want around what they have to do, based on original Medicare and medical necessity and whatnot. Okay. But you can have those plans that add those additional services. So they kind of bundle it all together and make it, and it's all kind of in one place, so to speak. You cannot pick up a Medicare supplement plan to cover the copays, in the Advantage plan that are counting towards that max out of pocket, though. So that leads me to supplements, and I'm gonna kind of spoof a little bit here, because really your two options when you go on to Medicare are, after A and B, you can decide to jump into an Advantage plan. So that would be one option. Another option would be to keep A and B as your primary, and then get a secondary in a Medicare supplement or a Medigap plan. Okay. And then on top of that, we would need to get a standalone prescription drug plan. So now it becomes more of an a la carte type of deal, where we're we're getting all of these things individually and lining them up. Okay. So I'm going to kind of run back down this list and just tell you, here's how a supplement differs from an Advantage plan. So as we go right down, if you go with the supplement, Medicare A and B, that is your primary. So the analogy that I like to use is like a tractor and trailer. A and B, that's your primary, that's your tractor. And your supplement is secondary, it's your trailer. It'll go anywhere the tractor pulls it, but it can't go anywhere if the tractor isn't pulling it. Okay. So what that means is it allows you to go to any doctor, anywhere, anytime, no referrals needed for a second opinion, anywhere in the country, as long as you go to a facility that accepts and bills Medicare. Okay. So there really are no networks other than the reaches of Medicare. Okay. Um, when it says that Advantage plans are optionally renewable every year, supplements, when you look at the guidebook that is put out by the Commissioner of Insurance, supplements are listed as guaranteed renewable for life. So what that means is a supplement, you're paying a premium on the front end, right? The Advantage plan, you could have no monthly premium. It's kind of the reverse for a supplement, where you're going to pay a premium on the front end, and you don't pay as much as you go, right? Because you're paying it up front. And every month that you pay that premium, your supplement is renewing. Okay. So as long as you pay your premium, then supplemental plans, they cannot cancel on you. Okay. They can't go away. There's no service area that's going to change. As long as you're paying your premium, you're good. That can't go away on you. Okay. Out-of-pocket costs can change over time. So one of the things with a supplement is because you are paying your premium on the front end, premiums are going to change. No company can get away from medical inflation and Medicare changing their numbers and people getting older and age inflation, all that stuff. It is going to factor in and premiums will change. There is not a company around that can get away from that. Okay. Um, and then when we talk about these additional benefits, if you go with A and B and a supplement, we need to pick up a drug plan. If you want dental and vision, we need to pick that up as well. Okay. So all things that are easily done, it's a different way of approaching. Okay. And then when we talk about prescription drug coverage, so Part D, it's only prescription drugs. We're not talking about vitamins, over the counters, anything like that, strictly prescriptions. And I tell you, this is one of the more important areas um, that we need to review every single year because there's a whole lot of there are a whole lot of variables. Okay, the number of drug plans has continued to drop. I've been doing this for about a dozen years, and when I first started, there were roughly 30 to 35 drug plans that were being offered in the state of Wisconsin, and for this year we're down to 14. And premiums are going to range, anywhere from $5 a month up to 130 or so. So these are very individual and it completely depends on the meds that we plug in. Okay. So, uh, that's where we really, I don't guess a whole lot when it comes to drug plans. Um, it's really, let's put your meds in and see which plans are popping up. But like I said, there are a lot of variables. So between the number of plans being offered, uh, premiums changing, deductibles changing, all these drug plans changing how they cover every individual medication, right? They could take one of your meds and cover it as a tier one this year, but next year they could change it to a tier three, or maybe they drop it off their formulary. So those are those are things we need to pay attention to, because if we're not paying attention, that could severely attack your pocketbook, to be honest with you. So those are things that we want to make sure that we do. Okay. Um, when we talk about Medicare, I know people have asked this question before. Medicare is very different from what we are used to with our group insurance, right? With group insurance, we're used to putting the whole family, spouse or kids or whoever, everybody under that same plan. But when we get to Medicare, it's all individualized. Okay. There are no family plans when it comes to Medicare. So everybody has their own A, their own B, and then you can pick your own supplement advantage plan um, and drug plan and all of that. And so the benefit of that is you don't have to try to fit one plan to all the medical needs of everybody. You can specify it to what your medical needs are and what your financial needs are. So that's a huge benefit, to be able to really tailor it to your own needs. Okay. Um, Another question that a lot of people will ask me, and if we kind of go back here, they ask me about the ability to change between advantage plans and supplements. So let me explain that real quick and follow me here. So let's say you decide to start with a supplemental plan, okay? And you go with supplemental company A. If a couple years go by and you say, Ben, I don't like supplemental company A anymore, I want to switch over to supplemental company B. Well, then what's going to happen is supplemental company B, they now get to health qualify you because you're no longer in those enrollment periods. So now they get to ask you health questions and they can use it against you and either accept or deny you. Okay. Um, as of right now, Advantage plans, they do not health qualify. They'll take anybody. Now, we might have to wait for an enrollment timeframe or the end of the year, but if you start with a supplement and you say, hey, I think I want to go into the Advantage plan world, well, then we probably got to wait until the end of the year, and then January 1st of the next year, we can get you into an Advantage plan, no questions asked. Okay, now let's reverse that situation. Let's say you start with an Advantage plan. Every year, just like drug plans, every year you can review your Advantage plan because it could potentially cancel on you, right? And you can change. You can jump around Advantage plans within the same company or bounce from company A to company B, and a new Advantage plan will start for you on January 1st. Now, if you want to, if you start with an Advantage plan and then you decide you want to go to the world of the supplement, as long as you do that within the first year of ever starting an Advantage plan, then we can make that jump anytime throughout the year, no questions asked. Within the first year of being on an Advantage plan, we can get you out, go to a supplement. But if you've been on an Advantage plan for longer than a year, and now you want to go to the world of the supplement, now we have to wait until the end of the year during the annual enrollment period. And those supplemental companies are going to health qualify you and they can accept or deny you. So, people ask me all the time, can I switch? And it's everybody's favorite answer. It's, well, maybe. It depends on your health. And, your health is the only thing that's going to allow you to make some of those moves. Okay. So just as a quick little review here and what your options are, A and B, I've had people ask me a few times over the years, well, can I just take A and B and nothing else? Well, yeah, you can if you'd like to. There's no law saying you have to pick up an Advantage plan or a supplement. However, not something I would recommend because original Medicare, it's an uncapped liability, which means if you got a whole lot going on medical wise, then the tab is going to keep running. And an Advantage plan or a supplement are there to give you a ceiling, to give you a cap so that you aren't continually paying 20% over and over and over again. Okay. So your options are you could just stick with A and B, original Medicare, or you could add in a supplement and you'll need a drug plan as well. You could go to privatized Medicare and kind of put everything all together in one ball with Part C. Okay. Prescription drug coverage. So it truly depends on you and your individual needs. And it is not uncommon to have, spouses have one choose an Advantage plan, the other choose a supplement. That can certainly happen. You don't have to choose the same companies. I know sometimes that can be an easier thing to do, but even if you go the route of the supplement, now you got to get a drug plan. Well, not all the companies that offer supplements offer drug plans. So it's not uncommon to have a few different companies in the mix here. Okay. Now, I represent a handful of different companies, whether they offer supplements, Advantage plans, or both, and then some that offer drug plans as well. And, I would love the opportunity to meet with everybody and, figure out what's going to be best for you. And I hope what you've gotten from me today is and understand about me and how I operate is I prefer to take more of an educational approach. I don't like being a pushy salesman. It makes me really uncomfortable. So my goal is to try and help you understand the process. And this is a great way to start doing it and to get this information in pieces, right? Get the basics of Medicare. Then we can follow up with some questions and then start delving into your different options with Advantage plan supplements and drug plans. And my goal is to make sure that you understand the differences and we find a path that best fits you. I don't care which direction you choose. I don't. I care that you are comfortable with your option and your choices and you understand them. That's the goal because your choices are going to affect you. They're not going to affect me. Okay. There's a whole lot of information out there. Mailboxes are probably busting at the seams. You got people calling you all the time. You know, I like to kind of shoot straight and make sure that people understand what's going on and keep you up to date on things. So, what else can I do to help you out? Well, again, I represent a number of different companies, and so I can help you sift through those because I'll tell you, if you go online and you want to try and get quotes for a handful of different companies, there's going to get to be a point where they're going to make you put in your email address or a phone number, and then they're going to start contacting you. So if you don't want that, I can get you all that information. I can get you the quotes, and I can talk about the differences between these companies and how they operate and their credit ratings. Are they strong financially, rating history, stuff like that. Okay. um, and what I tell my clients is, I'm happy to help. I'm not gonna make up answers. That puts my license on the line. So if I don't know the answer, I'll tell you, and then we got to figure out where to get that answer, and I'll help you do that. So I'm happy to be kind of that first call, and I will have some limitations just because of rules, because of laws like HIPAA, right? I'm not going to be able to call a clinic and talk on your behalf without you there. So, but I will do anything I can to try and help make the process easier and guide you along the way. So that's what I've got today, everybody. So I'm going to take a look at the chat here and see what if we've got any questions here. So give me just a moment.
And I can help you out with that too.
Perfect.
So the first question that came in, if annual physical is different from wellness exams, can I get both from my primary care provider each year? And will Medicare or my supplement insurance pay for both?
We'll go back to everybody's favorite answer. It depends. If you get a supplement, it is going to depend on the company that you go with. You're not going to get a full physical and a wellness exam. Medicare is only going to pay up to so much. So, but that's something that we can certainly discuss. But there are, when we talk about supplements in the state of Wisconsin, they are standardized, which means they all start the same, and you can build plans the same. The differences are going to be in premiums, but then when everything is standardized, then what's going to happen is, well, are there certain companies that will offer certain things to try to entice you to go with them and say, this is why you should choose us instead of them, right? Things like offering silver and fit or a gym membership, that kind of thing. So that is something that we can sift through. But not everybody, they're certainly not, most of the companies are not going to be picking up a full annual physical. They're going to be sticking to the Medicare wellness exam.
Sounds good. Next question. Do you work with long-term care insurance?
I do not personally. No. I kind of got into when I got into this business, a lot of companies that had provided long-term care were slowly starting to pull out of that market. It it can be kind of a sticky area, right? You really want to make sure that if you're looking at a long-term care policy, that you really truly understand how it's going to work, and make sure that it's going to benefit you. So I know as years have gone on, they're getting harder to get, going through qualifications, they're getting more and more expensive. So, um, is that something that you need, or is it something where, talking to one of our advisors at WDS, where they could maybe, help you allocate some money and put it into a place where it's going to grow, and maybe be accessible. I don't know. That's not my lane, but so short answer, no, I don't work with long-term care. Um, what is the fee to see me? Well, I don't charge a fee. Again, my goal, I work based on commission. So my goal is to help you understand it and hope that you want to work with me. And I can help find, a number of different options for you. And then the company that you choose, they are the ones that will pay me. So I know there are some agents out there that will charge just a consult fee to go talk to them. Right now, I don't do that. Haven't really thought about it too much as far as implementing that. So no, you don't pay me anything. Companies will pay me. So it's my job to get you to like me and want to work with me. So, um, am I familiar with how the UW's sick leave conversion? Do you work with many clients who are retiring? I am very familiar. So my mom was a cancer nurse at UW Hospital for most of her career, and she is working through her accumulated sick leave. I can't even help her right now. So I am familiar with it. Um, and while you have that sick leave, there's really nothing I can do for you until you're getting to the point where that sick leave is going away, where the funds are being depleted. So, um, is chiropractic covered? Yes. And again, depending on Advantage plans, they cover it. However they want to structure their plans. Um, Supplements in the state of Wisconsin, we have what are called mandated benefits, and part of those mandated benefits force supplemental plans to cover things like skilled nursing facility care, home health care, kidney disease treatment, diabetes treatment, and then chiropractic coverage, such as you know um, kind of usual and customary. So there is definitely some chiropractic coverage in there as well. Uh, does the privatized Medicare plan include prescriptions? It can. So there are There are Advantage plans that include prescription drug coverage. There are some that don't. It truly just depends on your needs and what you kind of your individual situation. So we can certainly, if you need it, we can certainly make sure we find one that does. I've heard of Plan G and Plan N. What are these? Oh boy. The extra letters they can be a little bit confusing, but the G and N plans and F plans, all that, they're referring to supplemental plans. So it's different structured plans. So like an N plan would be kind of like a copay plan. A G plan is going to be a little bit more of your quote unquote Cadillac style plan, where you're paying a premium and you don't have as much out of pocket as you go. So again, those are things that we can discuss further as we figure out what's going to be best for you and break down the different supplemental plans if that's the route that you want to go. Can I talk a little bit more about cancer treatments and Medicare? Yeah, I mean, cancer treatment, it's a medical necessity. I will tell you that my about 4 years ago, my dad was diagnosed with a brain tumor cancer. He passed away this past summer, and he was well taken care of. He had a supplement, and things were well taken care of. So, cancer is certainly a medical necessity. So it should be covered. So I guess I'm not exactly sure how much more to say about that, Sharon. You know, Even if you are coming into Medicare and you've already had a diagnosis and you're going through that, again, as long as you're in those enrollment periods, they still have to cover you. They can't say no, you were diagnosed prior to joining. No, they have to be a part of it. So can I show the first slide again that lists all the areas tasks that I can help with? Sure, I can try to get there. Hang on. And let me just go to the next question as I see it real quick. As far as wherever you live, I can work with anybody. Wherever you live in Wisconsin, I'm licensed in Iowa and Arizona and Texas and Tennessee, and so we can certainly meet in person. We also do have um, a Brookfield office that I can meet at. And, obviously online, if it's easier to just do virtual meetings, we can certainly do that as well. So we'll figure it out and we'll make accommodations as needed. How many months before turning 65 should we start the discussion? That's a really, really good question. In the state of Wisconsin, the law for being able to enroll in Medicare or even put applications in for a supplement or an Advantage plan, anything like that, the law is 3 months prior to when you're going to start. So if you have somebody call you and, if you're 4 or 5 months out and they say, hey, I can take care of you right now, right there, that's a red flag. And you should automatically know that they're calling you from a different state because they don't know the rules in Wisconsin. And I'll tell you, 3 months ahead of time, it's plenty of time to get things going. So typically what I would do is, we can get in contact 4 months ahead, schedule something for right away, 3 months out, and then get the ball rolling there. So I think it's plenty of time to do that. What Medicare is minimally needed at age 65 for you if you still have spousal medical coverage, assuming that's through a large group employer? Typically, you're going to take Part A. Okay, because it's premium free. You've already paid into it. You've earned it. You're entitled to it. So that's what I would do is take out Part A, and then it sits secondary to that group insurance. But again, I'm going to go back to if you are contributing to an HSA, that is going to throw a whole nother wrinkle into the mix. And that's something that we should talk about individually. Okay. I see that this presentation, thank you. I heard it was recorded. How do we access it to review it again at a later time? Jacob, I believe that this is all going to be online at at the WDS website. Is that correct?
Correct. So it'll take a few weeks for our marketing team to edit this. They'll create a 5 minute like recap video as well as the full recording. Both will be posted on the website underneath the events section where you can find the link to this. If it's something you come back to months and months in the future and there's a different event that's kind of highlighted, you can click into our YouTube channel and find all of our previous events there. They're all listed and included.
Thank you. Emailing a copy of the slide deck. Yes, here's what I'm going to ask you to do. On the page right now, if you take down my email address, shoot me an email and just say, hey, I was in your Medicare 101 webinar. Could you please send me a copy of the PowerPoint, and I can get you a PDF of that for sure. When do you need to be removed from HSA when getting close to enrolling in Medicare? I mean, if you're turning 65, you just stop at the month before you go on to Medicare at 65. But if you are beyond 65, then and you plan on contributing to the HSA, then you shouldn't take any part of Medicare because again, you can't overlap that, but then you have to be very conscious 6 months ahead of time because when you want to enroll in it, they're going to backdate Medicare A by 6 months. And that could effectively overlap that time. And then you'd have to pay 6 months back of that HSA. So 6 months ahead if you're beyond, Medicare timeline. Okay. Thank you, Sharon. I appreciate that. Let's see. If I turn 65 while my wife still works, can I stay on her insurance? Sure. Even if you're retired, that's fine. Would you still need Part B? Depends on if it's a large or a small group employer, if there's primary and secondary coverage. So if it's a large group employer, again, typically I wouldn't take Part B because the employer coverage stays primary, and then why pay a Part B premium when it's going to sit secondary? So that's what I would recommend. Again, I would always recommend go to HR where the health insurance is coming from and make sure everybody's on the same page with that. So, yep, send me an email and I'll share my slides. Can I help your sister in Florida? I am not licensed in Florida, unfortunately. So she's probably going to want to find somebody that is an agent that is in Florida to help out. Sorry. I say that cost is set based on your last 2 years of income. If you sold a house and land in those 2 years, their way to fight that. Yeah, again, they're going to send you a letter saying, here's what your Part B premium is going to be. And if you think it's too high, then here are all the reasons why you might think that, and you can appeal it and then just follow the directions in that letter as far as how to appeal that. And then hopefully they'll knock that down for you. All right, I think I got to the end.
Yep, I think you've got all the questions that have been posted. We still got a few more minutes, so if anyone wants to post or send a question into the chats to see one just came in, we still got a couple more minutes. I got a question too if we need to fill in a little bit of time. So I'll let you take that one. If from Lisa and Mike, will you help them with an appeal?
Um, I can certainly try to help. I think, they're probably going to want some information that having your financial planner helping out they're going to be a little bit more helpful in that situation. So, I'll help to the best of my ability. Let's see. Absolutely happy to help. Is there anything special transitioning from the ACA to Medicare. Um, just know that you're going to want to start Medicare, when you're 65, if you're on the Affordable Care Act leading up to that, and and then you'll have to call the marketplace, the Affordable Care Act hotline to cancel as you're getting near the end of that final month that you're going to be on that plan. So if you're over 65, still working, how long in advance before retirement should one contact you? You know, anytime So if you have an idea of when you're going to retire and when that coverage is going to end, because that's something that's important to know with your employer. If you say retire in the middle of a month, will your coverage go to the end of that month, which then means that you need to start the first of the next month, because Medicare is only going to start on the first day of a month. It is not going to start mid-month. So there are some employers on occasion where if you decide that you're going to retire mid-month, then your health insurance ends. So then we're going to want to start Medicare at the beginning of that month. So, but as soon as you know when your coverage is going to end, let me know, and then I can help organize a timeline and say, this is a good time for us to meet and get together because we know you need a start date of, such and such. So as soon as you have that, feel free to let me know, and then we'll plan it from there. Let's see. Hold on. Oh, sorry, I got all these emojis here that are getting in my way. WDS, great. Thank you, Nick and Debbie. Please comment again about sign-up period for people who have medical coverage from a spouse when they turn 65. What should you sign up for, and what can be done later? So again, talking to HR is important, knowing if it's a large or a small group employer, and typically taking Part A, but not Part B, assuming a large group employer. And then, we can pick up everything when the group insurance is going to end at a later date, and you won't have to worry about a penalty. Kevin, you're welcome. Yep, absolutely. Thank you so much, everybody. If you travel abroad when you're on Medicare, is nothing covered? Or so Advantage plans and supplements, you're going to have some sort of urgent and emergent services. So there is some coverage. Typically, what I tell people, if you're going to leave the country for an extended period of time, I would check out traveler's insurance. I don't offer it, but I don't think you have to spend an arm and a leg, but I would check out traveler's insurance to be a primary if you leave the country. It's not that nothing isn't covered. It's just you're probably going to want a little bit more. All right. Well, I think that's it. So thank you, everybody. I appreciate the nice comments as well. Please take down my information, and I'd love to hear from every one of you, and love the opportunity to help you out and make sure that we find a plan that best suits your needs and get you a nice retirement protection plan going forward. So I appreciate you being here with me, with us this evening, and look forward to hearing from you in the future. Have a good evening.
I got one last thing for anyone
Oh,
that's sticking with. In a couple of weeks, we will have our annual trivia night for charity. This year, we're for the benefit of Gigi's Playhouse. So you can find that information if you're a trivia rock star. Get your team together, come and compete. If you just want to have some good vibes and hang out with your advisor and the WDS staff and try your hand at answering some questions and hopefully win some raffle prizes, that works too. So reach out to your advisor or check out our website under the events tab if you want to find out some more information how to sign up and get a team. If you don't have a team and you just want to come by yourself or with a friend or a spouse, that works too. We can put you in a team of free agents. So we'd love to see you there and support a great local charity. Last year we raised over 55,000. I think this year our goal is over 60,000. So hopefully you can help us reach that, and it'd be great to just see you and hang out. So that's the last thing I have, and we'll see you at the next one.